VETtalk Radio is proudly supported by the Animal Referral Hospital.
This week,
are supermarket foods killing our cats?
They end up with vitamin B deficiency. Basically what that means is long-term it causes brain damage in cats.
And are domestic rats killing our pets?
They're very hard to treat. You can't just kill the ratworm off because then you actually get more damage to the tissue.
And do you know what to do if your pet is having a seizure?
It was common in first aid books to see things like, oh, wait till the seizure subsides. That is an absolute no-no.
We'll also explain the difference between a seizure and an epileptic fit.
Plus, this week we chat with probably Australia's most loving, caring pet mum. G'day, I'm Brian Pickering.
And I'm Kaye Browne.
All those stories and more right here on VETtalk, with our latest podcast available every Saturday via vettalkradio.com.au and also available free in the iTunes store.
Here at VETtalk, we know we love all our animals, and we do tend to talk a lot about dogs, but cats tend to go under the radar, except for a report published in the Veterinary Practitioner, which means it's been peer-reviewed and all sorts of good things like that, so you know it's true. And it's got some very scary information in it, and that is that some pet foods in the supermarket are not good for our cats. Now, I'm delighted to say that I'm joined by the lovely Dr. Anne Fawcett from Sydney Animal Hospitals. Hi, Anne.
Hello, Kaye. How are you?
Look, I'm really well, but I'm shocked and horrified and appalled that in this day and age that cats and other pets can be affected by pet foods we're giving them in all belief that we're doing the right thing. What is, I guess, the gist of this story?
So the main issue in this story is that we have detected some very high levels of sulfur dioxide preservatives in fresh pet meat. That is the kind of stuff that you get from the refrigerated meat section of the supermarket, designed especially for pets. And this is a type of preservative that is, it basically leaches the vitamin B from the animal system. So they end up with vitamin B deficiency. Doesn't sound too bad, but basically what that means is long-term it causes brain damage in cats.
Ew. So this could be happening without us really knowing about it. So what brought it to your attention and prompted you to write this amazing article? And I must say I'm really excited about this because it means we might be able to make a difference.
No, thank you. It actually has been reported before, strangely enough, a couple of decades ago in Australia, but since then not much has been done. And we had a cat presented to us, a beautiful senior cat who was having seizures, and we couldn't work out why. We tested the vitamin B levels. They were very low. We supplemented with vitamin B, and the cat suddenly changed. It became brighter. Wow. More focused. It was a really dramatic transformation, and it became apparent that this cat had been suffering from vitamin B deficiency for some time. I think one of the problems is these things tend to go unnoticed because, unlike people, we don't expect cats to be able to answer particularly intelligent questions or know what day of the week it is, or...
Some people might disagree, but I won't.
They might, but you can imagine that some degree of brain damage could conceivably go unnoticed by pet owners.
Definitely. So how did you manage to work out what it was that was causing the problem?
Now, one of the things that I did was I actually took the food to a laboratory and had it tested. I had several brands tested to compare the results, and it was clear there were really high levels of sulfur dioxide preservatives. To give you an idea, some of the foods had about 875 milligrams per kilogram, which is sky high. Some of the foods had 35 milligrams per kilogram.
Okay, so this is something that used to be in human foods too, but it's not anymore. But it's still in our pet foods. I mean, can we actually say where the food was that this cat was eating? Because the cat wasn't apparently eating anything else, was it? It was just eating this one food from the one supermarket.
That's correct. So the owner was thinking they were doing the right thing by their cat. They were getting food that their cat really enjoyed eating. And a lot of these foods are based on kangaroo meat, which cats get extremely addicted to. This particular cat wouldn't eat anything else, would only eat this particular brand of food morning and night. So it was being purchased from a mainstream supermarket by someone who had great intentions and managed to cause a really serious illness. The unfortunate thing is, although this has been reported before, it's not illegal to put this substance in cat food, which is kind of shocking because you can't put it in human food.
It's wrong because humans would have exactly the same problem. And if you think about it, and I have since reading your report, there must be a lot more cats that are getting this problem and they're getting a bit sort of wobbly in the legs, they can't walk and they're not eating and they just think, oh, it's old age, poor thing, time to go for Fluffy. But it's actually sulfur dioxide in fresh kangaroo meat. So what can we do about it? I mean, what can we do?
I think the first thing is to contact the suppliers of this food. The major supermarket chains, this is a really great opportunity for them to take a leadership role in this regard, because if they don't purchase this and put it, sell it to consumers, then obviously the companies who manufacture the food will have to change their practices. I think that's a really, really good start. We can try with legislation, but that's notoriously slow, and despite early reports, nothing's changed. So I think we need to try a different tack. And I guess I see the real change coming from the major supermarket chains.
I mean, let's call a spade a spade. It's Woolworths. Woolworths select kangaroo meat. I mean, perhaps they don't know. Well, now you know, Woolworths. What are you going to do about it? I've got to put the challenge out there because I don't want to hear about this happening. It was a lucky escape that you're able to turn things around. I mean, this must be comparatively common.
I guess the point that you made before, we think that probably it's more common than is reported. There's certainly a lot of owners who would dismiss these kind of signs as signs of aging, perhaps dementia, or signs of other disease in their cats. And certainly it's something that we'd need to look into further to get a really accurate picture of. But my concern is there's a lot of subclinical disease around, a lot of subclinical vitamin B deficiency.
Okay, now that's in vet speak. When you're saying subclinical, what do you mean?
Yeah, I guess by subclinical I mean something that doesn't quite cause obvious clinical signs. So maybe an obvious clinical sign to an owner might be seizures. They're very dramatic. They're impossible to ignore. But if your cat's feeling a little bit dopey or lightheaded or fuzzy or unfocused, that's not something that anyone but the most astute cat person is going to notice.
So the trick is to get to your vet sooner rather than later. It's not one of these things that you wait and see if it gets better.
I think that's one step, but the other step is to make sure that you are feeding a complete diet. And if your cat happens to be addicted to kangaroo meat, consider feeding human-grade kangaroo meat because that doesn't have sulfur dioxide preservatives in it. We know that. So you can still feed that meat that your cat likes the taste of. One of the things about these preservatives is they're designed to mask the signs of putrefaction, but they don't stop the meat from going putrid. They just mask the signs. So by, I guess, switching to a human-grade product, you probably have to go and buy a new supply a little more frequently. It's potentially a little less convenient, but that's so much more important to do for our cats.
And for all our pets, I'm a big fan of natural nutrition and providing that, even a super duper duper premium pet food can always be improved with just a little bit of extra fresh fruit and vegetables and things like that as well. Now, how can people tell if it's got sulfur dioxide? There's sort of numbers, 200s and something. Do you know those?
Yes. I have to go off my list because it's not on the top of my head. There absolutely are different numbers that are used, but it doesn't come across with a big warning label saying this contains sulfur dioxide preservatives. So some of the things that you'll see sulfite type preservatives, they might be under the numbers 220, 221, 222, 223, 224, 225 and 228. They're all sulfite type preservatives that can have detrimental effects to cats.
And dogs and people.
Indeed, yes. Fortunately, people don't eat this type of food, and interestingly enough, these kinds of meats, at least in my experience, seem much more popular with cats than dogs. But certainly there are cases reported in dogs as well. One difference, I think, is that cats seem to stick more closely to a routine diet. They seem to be much more creatures of habit where it comes to eating, whereas dogs are true omnivores. They do seem to have a bit more variety in their diet, so they're potentially going to be less vulnerable than cats.
Okay, but cats can benefit from variety as well as dogs?
I think so. I think that one needs to be careful when you're experimenting with your pet's diet. The more is not necessarily the merrier. I think that it's good to provide some variety, but introduce things slowly and in small amounts, just so you don't upset your cat's tummy, don't want to cause vomiting or diarrhea or create a food aversion. And don't despair if your cat turns its nose up the first time. Try again. One little trick is to warm the food. Sometimes that makes it a little bit more palatable. But definitely changing the diet dramatically is not a good idea.
But lots of different ones. Your cats love lots of different things, yeah?
They do. They do. At the moment, they're going through a bit of a fancy feast fad, which is interesting. But they're really into trying different things. Sometimes they'll even snaffle a bit of dog food, but I try to avoid that.
Dr. Anne Fawcett, I thank you so much for taking the time to talk to us today. And I really do, again, repeat that challenge. You've done the hard yards, you saved that cat's life, and hopefully we can get some changes happening with the supermarket chains with the sulphur dioxide.
Thank you so much, Kaye. This has been a really important issue, so I really appreciate you taking it on board.
We won't leave it just here. We'll come back to you and see how we go. We'll do a follow-up.
Thank you.
Thanks.
And that was Dr. Anne Fawcett, who has a great blog, actually. It's called Small Animal Talk. So if you want to keep updated on stories like this and lots more vet and pet stuff, check it out, www.smalanimaltalk.com. She's a lovely lady.
Oh, she's fantastic. And by the way, one of her recent blogs was something headlined Foophoria.
I know.
And that's more to do with the food coming out of the cat than going in. So I won't spoil the surprise. Maybe we'll get on and talk about Foophoria and why cats show such great delight.
If that's what turns you on, we'll do it. Well, from cats being poisoned by what they eat, we're going to move on to rats now, actually poisoning our pets overall. But we're not always aware of the symptoms. Now, Kaye was keen to find out if this was just an isolated problem or something bigger, and caught up with surgical specialist at the Animal Referral Hospital, Dr. Sarah Goldsmid.
So I've seen in the news that there are diseases caused by rats. No wonder people want to poison them. But what are the common ones that you see?
Well, we don't see a lot of them, so I don't know that common, but we have seen a few that we're suspicious with spinal disease that have had migrating ratworm larvae, and they're a little hard to diagnose. You have to do spinal taps. Sometimes we have to do advanced imaging to rule out other diseases, and they're very hard to treat. You can't just kill the ratworm off, because then you actually get more damage to the tissue if they die while migrating through the wrong place. So actually a lot of it is just supportive care and anti-inflammatory medication and so on to treat them. It's not very common, but we have had few reported cases, and we've seen a couple lately, so something to keep in mind. So another common issue related to rats and your own pets would be when you've used rat bait. And the rat bait that we tend to use is usually causing the rats to bleed and bleed out. So if your pet eats the rat bait or eats the rat that ate the rat bait, then they can end up with bleeding disorders if they're not treated quickly. So if you notice that your animal might have had access to that sort of thing, if you take them straight to the vet, they can do treatments to help prevent the disease from happening, because it takes a couple of days before the real signs start. So if you deal with it quickly, you have a better chance of preventing that disease happening in your pets.
So the common signs would be bloody diarrhea or something like that?
Depends on how much they eat and how big they are, but it could be that they have little blood blisters in their mouth, or that they bleed easily if they bang themselves or knock into something. They might have blood in their urine, or there's quite a few different signs that could occur. But if you're worried at all that there was access to that sort of thing, they need to be seen pretty quickly.
And before the weekend.
Yeah, 24 hours. They can come any time. We're always here. So if it did happen on the weekend or 2 a.m, should you be up at that time knowing that? We're here 24 hours. So come in if you're worried.
Fantastic.
She she's pretty good at getting that plug in about being open 24/7 at the Animal Referral Hospital.
Well, fair enough, because she has more than her fair share of overnight operations and surgeries that she has to do on emergency cases.
I know she's working today as well. That, of course, was surgical specialist from the Animal Referral Hospital, Dr. Sarah Goldsmid, and as she said, the ARH is open 24/7. They really do some amazing work. You're listening to Vet Talk, and you can get a new update every week
on Saturdays
via vettalkradio.com.au, or just go to the iTunes store and you can download it there onto your iPad or your iPhone. Now, a year or so ago, we had a beautiful, beautiful dog, little Matisse, our gorgeous Bichon Frise, who was having seizures, and sadly, he didn't handle those very well at all.
And it was very frightening to watch them, actually. Epileptic fits are not nice to see and would no doubt be very distressing for the animal too. So we thought it might be a good idea to ask someone who knows a little, actually a lot, about these things and how they differ. Dr. Joe Sillince, the CEO of Pets Australia. Hi Joe, welcome to Vet Talk.
Good evening. Okay. Now let's first deal with the issue of seizures and epilepsy, because they're tripping over each other in the same sentence.
Okay.
A seizure is an electrical disturbance in the brain that can be of greater or lesser degree that causes animals to essentially lose consciousness, and most times they get muscle spasm at the same time. Now, a seizure can be caused by any one of a million things, okay? It can be diet, for example, very low calcium. It can be diet in the case of some of the very worst of the unbalanced natural therapies or natural diets. It can be poisons, like rosemary poisoning or lead poisoning in cats, or antifreeze, or excessive chocolate.
Wow.
It can be infection, especially when there's a very high temperature, or it can be a brain tumour. Now, normally, seizures are called seizures until all of those kinds of things are ruled out.
Right.
And epilepsy is where you get seizures where there is no other known cause. So if you like, they're innate. The other thing is it tends to be diagnosed as epilepsy in younger dogs with relatively frequent seizures, because then you can rule out the pathology really readily, easily. And things like brain tumours are very unlikely in younger dogs. In older dogs, we tend to call them seizures because oftentimes you won't spend the time or the energy ruling out every possible other cause of pathology. Normally, epilepsy is related to scarring on the brain. Right. Not always. Sometimes it just happens. And that scarring is often caused by something that has now disappeared. But at the end of the day, it's irrelevant. The dog is seizing.
And I gather that dogs with seizure problems who've had them, even if they're controlled, are a bit more sensitive and a bit more clingy, definitely hungrier. Are there some other things that we need to be worrying about?
Look, some of that's medication and some of that is the nature of the animal. The seizure itself is like a short-circuiting across the brain. And so the seizure itself, electrical activity, doesn't really change innate amount of needing to be cuddled and held. But for those people with epilepsy, they will often report they're feeling a bit unsure of themselves, a bit nervous about when the next one's going to happen. They don't quite trust their body. And I think that we probably see a little bit of this in animals as well, where particularly after the seizure, when they're sort of there but not quite there, they're a bit confused, it's a little bit distressing, and their response to that is to seek comfort, which is usually to go for extra hugs and things like that, although there's quite a lot of animals with seizure activity that don't do that. They just, rock on in their normal fashion.
Yes, a number of people we've spoken to have said exactly that some of them are a bit feisty, I suppose you could say, a bit more excitable.
Yeah, and again, it depends on exactly where in the brain that electrical short-circuiting is happening, and also how well the animal is taking it. Now, in terms of that sedation that you're talking about, that is a direct result of the phenobarb. Phenobarb is a drug that calms excess electrical activity. So it doesn't only calm the source of the seizures, it also calms the rest of the electrical activity across the brain. And quite a lot of epileptic people who are held on phenobarb also report feeling sedated. And that's because essentially we've turned the volume down on their whole brain. And again, you'll often find in animals that have had some pathology where the pathology has been fixed or is resolving. Let's give you an example of encephalitis or meningitis. they'll often tend to, quote, come good. But in animals that are a bit phlegmatic, a bit sort of, hard to get excited about everything, that can be a bit hard to tell.
Mm. Is there some way of picking if a dog's going to become susceptible to seizures?
The short answer is you always take seizures seriously. Around the turn of the century, it was common in first aid books to see things like, wait till the seizure subsides. That is an absolute no-no, because we don't know whether that seizure is going to subside in 10 seconds or 30 minutes. Mm. But we do know that while ever that animal's seizing, it is at imminent risk of death. Mm. So we do take seizures seriously. Mm. And in an animal that's had a history of seizures that are now controlled, if it seizes, that tells us that it's breaking through the medication, and that also requires immediate attention. Mm. Rule 1, do not stick anything in the mouth. Okay, most animals, if you stick things in the mouth, you actually increase their risk of choking, not decrease it. Again, the last century's textbook used to say put something to stop them swallowing their tongue. That's rubbish.
Oh, that was what they used to say when I was at school, and one of the girls used to have epileptic fits at the time. So.
Yep. Look, if you've got someone seizing or you've got a pet seizing, you get it to a surgery, a veterinary surgery, immediately. If it stops seizing on the way, you've probably bought yourself some more time. But you don't know that. Okay? All you see is an animal seizing in front of you. You assume that it's going to go on forever. You know that abnormal electrical activity is damaging brain cells and potentially damaging oxygenation. So you just get the animal and you ship it. You ship it to the nearest veterinarian. Now, this is a real issue, of course, because a lot of these animals, and there are a few out there, and owners who are very diligent about giving medication and who really care for these animals and do a beautiful job while they're in their normal routine. But what you will find is that animals with a history of seizures will be perfectly stable in their normal routine and then break when they are out of routine. And this is an issue for boarding kennels and grooming salons and places like that, where they've got animals that are out of their normal routine, and it's all terribly exciting. There's other dogs, and there's, a bath to be had, and there's walks to be had. And what happens is when they're on medication for seizures, you go as low a dose as possible, because that minimises the sedation. And then after that, they get excited, they break through with a seizure, and our recommendation to every pet business is we don't care whether they're breaking through their meds or whether it's a first-time seizure, they get sent to the vet immediately.
Well, that makes sense. Okay. I wish I'd heard this sooner. I should have done one of your courses, Jo.
So it's a case of keep an eye on the website, and we'll announce further courses. If anyone would like to be put on the wait list, just email us and we'll wait list.
Can the general public do this? Can average pet owners do this first aid course as well?
We have about half of our pet first aid courses are full of, quote, average pet owners. There's no such thing as an average pet owner. They're all extraordinary. But, we have about half the numbers going through the courses are pet owners, and they really love it. It's BYO dogs, so you get to practice on your own dog, and the dogs love it because they're getting lots of fuss and attention, and it's a lovely day out, and they get to share the owner's lunch.
Sounds good. So that website again, petsaustralia.org, and they'll get to meet the lovely Dr. Jo Sillince. And you are lovely.
Thank you.
Thanks, Jo.
All right, have fun.
We always have fun, Jo. Don't worry about that. That was CEO of Pets Australia, as Kaye said, Dr. Jo Sillince. Those first aid courses are a great idea. Actually, we should do them.
We definitely should do.
Think we could get a freebie?
I don't know about that.
I don't know. We're giving you all this publicity. It is a bit more serious than that. I think it's very useful to at least know what to do, how to do it.
I did the St John's ambulance one for humans, so it would make sense to do one for pets as well.
On the line, we have probably Australia's most devoted mum. In fact, she's the wife of Australia's most devoted dad to a dog called Bart. Welcome to VETtalk, Teangi Chambers.
Thanks, Brian.
Let's just start from the beginning. Tell us about Bart. What's Bart's story?
I think he's probably Australia's maybe the world's most loved dog. He's a cattle cross staffy. He's 15, just gone 15 years old back in July. He came into my life when I met my, then partner Stuart. He's now my husband. And
I heard you married him because of Bart.
There is a rumour going around for that, and I certainly won't dispute it, but I can't confirm it either.
Okay.
But he's certainly an added benefit to the whole situation.
So Bart came with benefits, a human as well. That's very handy. So why is Bart so special?
Well, I guess everyone thinks their dog is special. I think Bart's special just because he's had so many things he's dealt with throughout his 15 years, so many ups and downs, and he just inspires me with his attitude, and he just gets on with life, and no matter what it throws at him, he doesn't complain, he doesn't say he can't do this, and he just gets on with making the best out of every situation.
The amazing thing is that Bart has his own Facebook page. How did that come about?
Well, I just started it up just for a bit of fun one day, and then I have another page that I do with some artwork, and he was quite chatty on that page, and he certainly started to actually take over. So from a business point of view, I thought, okay, Bart needs to go on his own, and he certainly does a lot better than I do in that respect. So that's how it all sort of, nothing planned, it just sort of came out organically.
Yeah, well,
we love it.
We've seen some, well, we love it too, as do a lot of the people following Bart. Now, I came across Bart and Bart's story because, as you know, I was in at the Animal Referral Hospital recently and doing some videotaping of Dr. Amy Lane, who's an oncologist there, and Bart was in for a checkup.
Bart has a long history with the Animal Referral Hospital. It goes back about 3.5 years now. He's had some issues and he's had 2 stays there now with his most recent one. But the oncology side of things, the day after Bart's 15th birthday, we had a massive big birthday party for him with heaps of red balloons because he loves to pop balloons. And that next day I was giving him a cuddle and I found a lump under his arm.
Oh, yeah.
After about a week of tests, he had a biopsy and had the lump aspirated. We sent it off, and he had all the different sort of slides and stains done to the lump to see what we had, and unfortunately it came back pretty bad news. Bart doesn't do things by halves, so if he's going to have a tumour, he's going to have the most aggressive one possible. But we still don't really have a name for it because it's one of those ones that just doesn't want to be identified. But yeah, it's not great news, so that's how we met Dr. Amy and all the other fantastic people at ARH.
And so what did they tell you might happen? I mean, when people hear the word cancer and things like that, it's always scary and you think the worst. You know, you must have been very worried.
Oh, we were devastated. I mean, we still are. It's certainly not an ideal situation. We're very much dealing with it better now and just sort of taking it as a challenge rather than bad news. But yeah, we were very upset. We were very confused. I think the worst thing is the waiting. Having the test done and then waiting for that test, and then that one either not coming back or coming back inconclusive, or another one being needed, and then waiting for that appointment and then waiting for those results. And I think that was probably the most challenging thing, the not knowing. And now we're at the stage where we still don't know everything, but we know where we're going. Yeah. So that's comforting, I guess.
I saw that with you and your husband, Stuart. You both seem quite, I guess, resigned to how things are going at the moment. And Bart's not a young boy anymore. He's had lots of things go on in his life. So what treatment did Bart get over what period of time?
Yeah, well, we've only had this diagnosis for 10 weeks now, I think. Mm-hmm. So it's all been a bit of a whirlwind. We only saw Dr. Amy Lane 9 weeks ago, but it feels like a lot longer. Basically, Bart, they started out with our local vet here in the Blue Mountains with an aspiration to determine what the lump was, and the biopsy was also carried out there. Once we realised we were dealing with, it's called an anaplastic sarcoma, we decided that we probably needed some specialist care, so we plopped on down to ARH because we've had such good dealings with them in the past. So that time we actually saw a surgeon prior to seeing Dr. Amy to see whether the lump was localised and whether amputation would be an option to contain the cancer. At that point he'd already had chest x-rays done, but we had a CT scan done to determine whether the cancer had spread. And unfortunately, we were in for some more bad news to find out that it actually had moved on to his lungs and possibly even his liver.
And he's still there. I mean, I saw him in person and he looks fighting fit to me.
So You started the first lot of treatment, medical therapy. What happened then?
Well, he went on to a cancer-controlling drug. We call it chemotherapy, but I don't think it technically is. It's to control the growth of the tumour. During that time, he did a good job. You know, a lot of dogs, a small percentage, I believe, but if it's going to affect someone, it's going to affect Bart because he's not really good tolerating medications. He has a bit of a dicky liver. He went on the medication and everything was going really good, and obviously amputation was discussed early on, but we discounted that because once Bart started the medication, his mobility improved greatly because he was in quite a bit of pain on his right forearm where the tumour was, and everything was going great for about 2 weeks. And unfortunately, Bart, being the tricky dog he is, started to react to all the medications, and we really struggled with pain management. And we got to the point where Bart was pretty much no longer weight-bearing on that leg. So we had to make a decision then as to whether we would continue plugging away with pain management that just didn't seem to be working, or whether we preempt, I guess, what was going to happen. The tumour was eventually going to either cut off the blood supply to his limb or the plasma supply, both causing pain and just rendering that limb useless. So we made the big decision to amputate. Within 24 hours we made that decision because it was all pretty urgent to make.
That's a pretty major decision to make. So what's the result now with Bart? How's he going?
Yeah, he's going great. You know, I say this to everyone, Bart is a back-to-front dog. If someone says he can't do it, or if someone says he's going to react in a certain way, he generally does the opposite. And everyone was a little bit concerned because Bart has quite severe osteoarthritis through his hips and all his limbs and his spine. So everyone was a little bit concerned, but I have faith in Bart. I knew he could do it, and he has gone along leaps and bounds, literally. Yep. He's a fantastic little ambassador for I Can.
I have to say that you and Stuart are two people who have made decisions that a lot of other people would just not even think about making. I mean, why, maybe why is the wrong question, what motivates you to do so much for such an old dog?
That's simple. What's best for Bart is best for everyone. So, you know, he comes first. Every decision we make is in his best interest. We don't, we've had to do a fair bit to change our lives to accommodate this, but that doesn't matter because it's not about us. He's the one who has the cancer, and we'll just do everything we can. His age, you know, he has a lovely inner medicine specialist, Dr. Catherine Briscoe, at ARH, and she has this wonderful saying, age is not a disease. And that's exactly right with Bart. I think he's doing so well for his age, and, you know, there's no reason to discount a dog because of their age. Every dog has their own personality, their own strengths, and it's very well likely that he's coping with this at 15 than better than a younger dog would. So I don't think age is something you can take into these sorts of decisions. We need to look at the bigger picture. And in any case, a senior dog is the most amazing companion. That bond that grows over time. You can't replace or replicate that.
Oh, you won't get any argument from us. Unfortunately, we've had a few very, very old dogs, and while we haven't gone to the lengths that you have, we have gone a fair way. So, you know, how many more birthdays do you think you might have with Bart?
Oh, he wants to make Sweet 16. He has to make Sweet 16. We have already made arrangements for Christmas presents, so that's
Excellent.
Our next goal.
Excellent.
Yeah.
Excellent. Speaking of Christmas, I do have to ask you, Bart has a wonderful thing on his site, which he talks about paying good things forward. What's that?
We have a love for all animals, and all animals don't necessarily have what Bart has. So we set up a little group in Bart's name, and he has a very generous following. So we set up Team Bart to the Rescue, and that's about everyone sort of combining. You can make a little small gesture that combines a whole bunch of people making that one small gesture, and they become large. So we set that up to try and spread a little bit of love to some animals that don't necessarily have that one person or two people looking after them and being able to give as much to them as we can for Bart.
Teangi, thank you very much for your time today. You and Stuart, two amazing people, and Bart is obviously an amazing dog, and we can tell just how much you love him, and no doubt he loves you as well.
Oh, thank you very much. We love to tell Bart's story. He's such an amazing character, and if we can pass on that one little bit, then that's a great thing. So thank you.
If anyone wants to catch up with Bart and what's happening, where's the best place to go?
Yeah, Bart can be found doing his Team Bart to the Rescue work, which he usually sleeps through. But he's on Facebook if you search for Team Bart to the Rescue, or if you put in facebook.com/Team Bart to the Rescue.
Fantastic.
You'll be able to find him there.
And he's obviously got a good team of humans behind the scenes helping him?
Oh, of course. He does most of the work by sleeping through it.
Oh, good. Thinking it through, yeah. Fantastic. Thanks, Teangi, and we'll talk to you again soon and see how Bart's going.
Great. Look forward to it.
Thanks, Teangi.
Alrighty, it's time for our news update. KB, what have you got for us?
Well, this time of the year is a very good time to take an extra look at your shoes before you put them on, if you've left them outside, because if you happen to find a funnel web spider, you wouldn't be on your own, but please do not squash it. Okay, every year the Australian Reptile Park puts out a call for live funnel webs, and not just any funnel webs. They actually want the male funnel webs, although I don't know.
Oh, right, so I'm going to go around, lift them up. Oh, male, female. Oh, no, that's a definite. No, it's a female. I'll put that back. Great.
I think just treat them all as disgusting little nasty things. But if you do happen to capture them without injuring yourself and you're able to take them to the reptile park, you'll be doing a great thing, because every year the park needs at least 200 male funnel web spiders so that they can produce enough venom, which then goes off to the laboratory to be made into anti-venom and saves lives if someone happens to be bitten.
Or anti-venin. Which one is it?
I think it's either or. It depends which school you go to.
We'll stand corrected on that.
But last year they only got 100. So there's not a shortage at this stage, but there could be if there are a lot of bites happen and things like that. And of course, remember, should you be bitten by just about anything nasty, and Australia has lots of nasty things, go to the vet if it's an animal, and if it's a human, go to the doctor. Now, very quickly in other news, I did want to point out that it's always a good idea to make sure that your dog is around you almost all the time. A couple in the UK got extra lucky because they thought they were already pretty darn lucky, because they actually won £150,000 in a lottery. Sounds pretty good, $300,000, right?
Yeah.
But the dog, jumping into the car, happened to bunch a catalogue, and hello, another lottery ticket fluttered out. A second winning ticket in the same lottery. You see, it turns out that Mr. Slater happened to buy a ticket, and Mrs. Slater didn't know that he'd already bought one, so she bought one too, and apparently they've been using the same numbers for 20 years.
Really?
Yep.
Sounds a bit like us.
Hallelujah. So guess what? The lotto company had to pay out a second time, so double the earnings. Thank you very, very much, Ruby, the dog.
I'm going to try that for the next Oz Lotto. We'll just pick the same numbers, 2 tickets, right?
Yep.
And we both win.
Don't know if they'd do that in Australia. This was in the UK.
Alrighty.
So a very quick wrap-up of news, because we've been very, very busy.
It's been a bigger show today, so thank you for that news. And, of course, that is the end of this week's show. If you like what we do, please tell us and pass it on to a friend. We'll see you again next week, same time, same station, for VETtalk.
It's not a station.
Oh,
it's online.
All right, same online. See ya.
See you next week.
Bye.